regulates gastric emptying. Curvatures and surfaces. The greater curvature is the longer, convex lateral border of the stomach that extends from the cardia to the pylorus. It provides attachment for the greater omentum, a significant peritoneal fold that drapes over the intestines. The lesser curvature is the shorter, concave medial border of the stomach. It serves as the site of attachment for the lesser omentum, which connects the stomach to the liver. The anterior surface of the stomach is related to the diaphragm, left lobe of the liver, and anterior abdominal wall. The posterior surface lies in close proximity to the pancreas, spleen, left kidney, and adrenal gland. These structures collectively form the stomach's bed, a term used to describe its posterior anatomical relations. Internal anatomy of the stomach, mucosal folds, rugae. Internally, the stomach is lined with mucosal folds, known as rugae. These folds are most prominent when the stomach is empty and serve to increase the organ's surface area. During food intake, they allow the stomach to expand significantly without increasing internal pressure. Gastric pits and glands. The surface mucosa of the stomach is punctuated by numerous invaginations called gastric pits. These pits lead into gastric glands, which are responsible for the secretion of various substances necessary for digestion, including acid, enzymes, mucus, and hormones. Histological layers of the stomach wall. Mucosa. The mucosa is the innermost layer of the stomach wall and consists of three components: the epithelium, lamina propria, and muscularis mucosae. The epithelium is made up of simple columnar cells that secrete mucus to protect the stomach lining from the harsh acidic environment. The lamina propria is a connective tissue layer that contains capillaries, lymph vessels, and immune cells. The muscularis mucosae is a thin layer of smooth muscle that aids in the movement of mucosa and helps expel glandular contents. Specialized cells found within the gastric glands include parietal cells, which secrete hydrochloric acid, HCl, and intrinsic factor, chief cells, which produce pepsinogen, mucous neck cells, which secrete mucus, and enteroendocrine G cells, which release the hormone gastrin. These cells play a pivotal role in the digestive processes occurring in the stomach. Submucosa. The submucosa is composed of dense connective tissue that houses larger blood vessels, lymphatics, and nerves. It provides structural support and contains the Meissner's plexus, a network of nerves that regulates secretions and local blood flow within the mucosa. Muscularis externa. The muscularis externa of the stomach is unique because it contains three layers of smooth muscle rather than the typical two found in most parts of the gastrointestinal tract. These layers are the inner oblique, middle circular, and outer longitudinal layers. Together, they allow for powerful churning and mixing movements, enhancing the mechanical digestion of food. Serosa, or visceral peritoneum. The outermost layer is the serosa, also known as the visceral peritoneum. It is a smooth membrane that covers the external surface of the stomach, reducing friction between the stomach and surrounding organs during movement. Gastric juices and secretions. Hydrochloric acid. Hydrochloric acid is secreted by the parietal cells and maintains the stomach's highly acidic environment, with a pH ranging from 1.5 to 3.5. This acid denatures dietary proteins, facilitates the activation of pepsinogen into pepsin, and destroys ingested pathogens, thereby playing a crucial role in both digestion and immunity. Pepsinogen, secreted by chief cells, is an inactive enzyme that is converted into pepsin upon contact with hydrochloric acid. Pepsin is a protease that breaks down proteins into smaller peptides, initiating protein digestion in the stomach. Mucus. Mucus is produced by mucus cells and forms a protective barrier that coats the stomach lining. This barrier prevents the stomach from digesting itself and protects against the corrosive effects of hydrochloric acid and pepsin. Intrinsic factor. Intrinsic factor, also secreted by parietal cells, is essential for the absorption of vitamin B12 in the ileum. A deficiency in intrinsic factor leads to pernicious anemia, a condition characterized by impaired red blood cell production. Gastrin. Gastrin is a hormone released by G cells in the pyloric antrum. It stimulates gastric acid secretion, enhances gastric motility, and promotes the growth of the gastric mucosa. Gastrin release is triggered by the presence of peptides and amino acids in the stomach. Physiology of gastric function. Gastric motility. Gastric motility involves coordinated muscular contractions that facilitate the mechanical digestion and propulsion of food. It can be divided into 3 phases. Receptive relaxation occurs when the fundus and upper body of the stomach relax to accommodate incoming food. Peristaltic contractions begin in the body and move toward the pylorus, mixing the food with gastric secretions. Gastric emptying is regulated by the pyloric sphincter, which ensures that only small amounts of chyme enter the duodenum at a time. Gastric digestion. Digestion in the stomach involves both mechanical and chemical processes. Mechanically, the stomach churns food through peristaltic movements. Chemically, the acidic environment and enzymes like pepsin break down complex macromolecules into simpler forms, suitable for absorption in the small intestine. Gastric absorption. Although the stomach is not a primary site for nutrient absorption, certain substances such as alcohol, aspirin, and some water-soluble drugs can be absorbed directly through the gastric mucosa. Neurohormonal regulation of gastric function. Cephalic phase. The cephalic phase of gastric secretion is initiated by the sight, smell, taste, or thought of food. This phase is mediated by the vagus nerve and stimulates the secretion of gastric juices even before food enters the stomach. Gastric phase. The gastric phase begins when food reaches the stomach. It involves both mechanical stretch of the stomach wall and chemical stimulation by partially digested proteins. This phase leads to further stimulation of gastric secretions and motility. Intestinal phase. The intestinal phase starts when chyme enters the duodenum. Initially, it stimulates gastric activity, but subsequently inhibits it through mechanisms like the enterogastric reflex and the release of hormones such as secretin and cholecystokinin. These hormones reduce gastric secretions and slow gastric emptying to allow adequate digestion and absorption in the small intestine. Associated structures and blood supply. Blood supply. The stomach receives a rich blood supply primarily from branches of the celiac trunk. The left gastric artery supplies the lesser curvature, while the right gastric artery contributes to the same area from the hepatic artery. The right and left gastroepiploic arteries supply the greater curvature, and the short gastric arteries serve the fundus. Venous drainage parallels the arterial supply and ultimately drains into the portal vein, allowing nutrient-rich blood to pass through the liver for processing. Lymphatic drainage. Lymph from the stomach drains into the gastric and celiac lymph nodes. This pathway is clinically significant because gastric cancers often metastasize through these lymphatic channels. Innervation. The stomach is innervated by both the parasympathetic and sympathetic nervous systems. Parasympathetic innervation is provided by the vagus nerve, which enhances secretory and motor activity. Sympathetic fibers arise from the celiac plexus and serve to inhibit gastric activity and constrict blood vessels. Pathological considerations. Gastritis. Gastritis is the inflammation of the gastric mucosa and may be acute or chronic. Common causes include infection with Helicobacter pylori, prolonged use of NSAIDs, alcohol consumption, and stress. Peptic ulcer disease. Peptic ulcers are erosions in the mucosal lining of the stomach or duodenum, resulting from an imbalance between aggressive factors like acid and pepsin and protective mechanisms like mucus and bicarbonate. They are frequently associated with H. pylori infection and NSAID usage. Gastroesophageal reflux disease, GERD. GERD occurs when the lower esophageal sphincter fails to prevent the backflow of stomach contents into the esophagus, leading to symptoms such as heartburn and regurgitation. Gastric cancer. Gastric cancer often presents in advanced stages and is associated with risk factors such as chronic gastritis, H. pylori infection, smoking, and dietary habits. It commonly metastasizes to regional lymph nodes and distant organs. Gastroparesis. Gastroparesis is a condition characterized by delayed gastric emptying in the absence of any mechanical obstruction. It often results from vagus nerve dysfunction and is commonly seen in diabetic patients. Embryological development. The stomach originates from the embryonic foregut and undergoes significant morphological changes during development. Initially, it forms as a simple tubular structure that subsequently enlarges and rotates 90 degrees clockwise around its longitudinal axis. This rotation brings the left side of the stomach anteriorly and creates the greater and lesser curvatures. The differential growth of the dorsal and ventral walls contributes to its final J-shaped appearance. Stomach, in clinical imaging and endoscopy. The stomach can be examined using various diagnostic tools. X-ray imaging with barium contrast highlights the stomach's shape, position, and motility. Endoscopy allows direct visualization of the mucosa and facilitates biopsy for histological examination. CT and MRI scans are useful for evaluating structural abnormalities, tumors, and complications, such as perforation. The stomach is a sophisticated organ integrating anatomical architecture, enzymatic activity, and neurohormonal control to facilitate digestion. From its layered histology to dynamic motility and robust secretion, the stomach's design underscores its central role in gastrointestinal physiology. Understanding its complex structure and function is crucial, not only for academic knowledge, but also for diagnosing and managing various gastrointestinal disorders.
The nose is one of the most noticeable features on the human face and plays a vital role in both appearance and function. Beyond its role in breathing, it contributes to our sense of smell, influences the way we speak, and helps protect our respiratory system by filtering and warming the air we breathe. Despite its small size compared to other organs, the nose is incredibly complex, containing a combination of bone, cartilage, mucous membranes, and nerve endings that all work together seamlessly. To understand how this organ functions, it is important to explore its structure, the parts that make it up, and how each of those parts contributes to its purpose. While the external appearance of the nose is what most people recognize, its internal components are far more intricate and fascinating. These parts not only allow us to smell, but also serve as a first line of defense against harmful particles in the air. People who are not from a biology background might think of the nose simply as the place where air enters and exits the body, but it does much more than that. It acts like a natural air filter, humidifier, and even contributes to how our voices sound. This detailed explanation will walk you through the different components of the nose and how they function, using clear and simple language that anyone can understand. Parts of the nose. The nose is generally divided into two main parts: the external nose and the internal nasal cavity. The external nose is the part that is visible on the face, while the internal nasal cavity is the part that is located inside the skull. The internal structure is much larger than it appears from the outside and connects to the sinuses, throat, and even the ears in some ways. The external nose includes the nostrils, also called nares, the nasal tip, and the bridge. The nasal skeleton underneath is made of a combination of bone and cartilage, which gives the nose its shape and structure. Cartilage is a flexible tissue that is softer than bone, which allows for a degree of movement and flexibility. The internal nose, or nasal cavity, is divided into two halves by a thin wall called the nasal septum. Each half of the nasal cavity has its own passage for air to flow through. Inside the nasal cavity, there are important structures called turbinates, also called conchae, which are curved bony plates that help to warm, moisten, and clean the air as it passes through. Within the nose, there are also the olfactory receptors, which are responsible for detecting smell. These receptors are located at the top of the nasal cavity and send signals to the brain via the olfactory nerve. In addition to this, the nose contains mucous membranes that produce mucus, which helps trap dust and pathogens. External nose. The external part of the nose is what you see on the face. It is made up of skin, muscles, connective tissues, cartilage, and bone. It starts from the root of the nose, which is located between the eyes and ends at the tip or apex of the nose. The bridge of the nose is the upper portion that is supported by nasal bones, while the lower portion is supported by cartilage. The nostrils, or nares, are the two openings at the bottom of the nose that allow air to enter and exit. These nostrils are surrounded by wing-like structures called the alae, which are composed mainly of cartilage and covered by skin. The tip of the nose, known as the apex, is soft and mobile because it is mostly cartilage. The overall shape of the external nose varies from person to person and is often influenced by genetic factors. The external nose also includes a thin strip of skin called the columella, which separates the two nostrils from each other. This visible part of the nose plays an important role in aesthetics and facial symmetry, but also serves as the entryway for air to reach the inside of the nose. Nasal septum. The nasal septum is the thin vertical wall that separates the left and right nasal cavities. It is made of both bone and cartilage. The front part of the septum is cartilage, which is soft and flexible, while the back part is made of bone and provides structural support. A properly positioned septum ensures that both sides of the nose receive equal airflow. However, in many people, the septum may be slightly off-center. This condition is known as a deviated septum, and it can lead to breathing problems, frequent nosebleeds, or sinus infections if severe. The nasal septum also supports the structure of the nose and helps maintain its shape. It is lined with mucous membrane that contains tiny hair-like structures called cilia, which help move mucus and trapped particles toward the throat, where they can be swallowed or expelled. Nasal cavity. The nasal cavity is the large hollow space behind the nose. It extends from the nostrils to the back of the throat. This cavity is lined with a mucous membrane that helps to trap dust, germs, and other harmful particles. This membrane also keeps the inside of the nose moist and helps warm and humidify the air before it reaches the lungs. Inside the nasal cavity are several structures called turbinates, or nasal conchae. These are bony projections covered with soft tissue. There are usually 3 turbinates on each side: the superior, middle, and inferior turbinates. These structures increase the surface area inside the nose, which allows for better filtering and conditioning of the air. The nasal cavity also contains small openings that connect to the paranasal sinuses. These are air-filled spaces in the bones of the skull that help reduce the weight of the head, produce mucus, and affect the sound of our voice. The sinuses include the frontal, maxillary, ethmoid, and sphenoid sinuses. Turbinates. Turbinates, or nasal conchae, are curved bones inside the nasal cavity that are covered in a thick layer of mucous membrane. They are responsible for increasing the surface area within the nose, which helps in conditioning the air that we breathe. The superior turbinate is the smallest and sits highest in the nasal cavity, while the middle and inferior turbinates are larger and sit below. The turbinates play a crucial role in filtering and warming the air. As air passes over the turbinates, it is cleaned by the mucus and warmed by the blood vessels within them. This process ensures that the air entering the lungs is at the right temperature and free of harmful particles. When the turbinates become swollen due to allergies or infections, it can lead to nasal congestion and difficulty breathing. In some cases, enlarged turbinates may need to be treated with medication or even surgery to restore normal airflow. Olfactory region. At the top of the nasal cavity is a special area called the olfactory region, which contains the receptors responsible for our sense of smell. These receptors are part of the olfactory epithelium, a thin layer of tissue that detects odor molecules in the air. When we breathe in, air carrying different smells travels up to this area, and the receptors send signals to the olfactory bulb, a structure located just above the nasal cavity in the brain. The olfactory bulb then processes these signals and sends them to the brain where the smell is identified. This sense of smell is closely connected to our sense of taste. That's why food seems tasteless when you have a blocked nose. The olfactory system is delicate and can be damaged by infections, injuries, or even aging, leading to a reduced or complete loss of smell, a condition known as anosmia. Mucous membranes and cilia. The inner lining of the nose is covered with mucous membranes, which secrete mucus to keep the nasal cavity moist. This moisture is essential for trapping dust, bacteria, and other particles that could be harmful if they reach the lungs. The mucus is sticky and helps hold on to these invaders until they can be removed. Along with mucus, the nose also contains cilia, which are microscopic hair-like structures that move in a wave-like motion. These cilia push the mucus and trapped particles toward the back of the throat, where they can be swallowed and destroyed by stomach acid. This cleaning system is very effective and works continuously to protect our respiratory system. When we are sick, this process can slow down or become overwhelmed, leading to a stuffy nose or sinus infection. Drinking water and using humidifiers can help keep the mucous membranes healthy and functioning properly. Paranasal sinuses. The paranasal sinuses are air-filled spaces within the bones around the nose. They are connected to the nasal cavity by small channels. These sinuses include the frontal sinus in the forehead, maxillary sinus under the eyes, ethmoid sinus between the eyes, and sphenoid sinus behind the eyes. These sinuses help reduce the weight of the skull, improve voice resonance, and produce mucus that drains into the nasal cavity. They are lined with the same type of mucous membrane as the nasal cavity, so they also help trap and remove harmful particles. When the sinuses become inflamed due to infection or allergies, it results in a condition called sinusitis, which can cause facial pain, pressure, and difficulty breathing through the nose. Healthy sinuses are normally filled with air and allow mucus to drain easily, but blocked sinuses can lead to discomfort and infection. Blood supply and nerves. The nose has a rich blood supply which helps warm the air as it passes through. Several arteries supply blood to the nose, including the facial artery and branches of the internal and external carotid arteries. Because of this rich blood flow, the nose can bleed easily, especially in dry conditions or due to trauma. The nose is also connected to many nerves, which allow it to sense touch, pain, temperature, and smell. The most important nerve related to smell is the olfactory nerve, cranial nerve I. Other nerves provide sensation to the skin of the nose and its internal structures, including the trigeminal nerve, which is responsible for facial sensations. These nerves play an important role in triggering reflexes such as sneezing, which helps clear irritants from the nose. The nose is sensitive to many types of stimuli, including strong smells, dust, and changes in temperature. Function and importance. The nose is not just an entry point for air, it is a multifunctional organ that plays an essential role in protecting and supporting the respiratory system. Its design ensures that the air we breathe is clean, warm, and moist, which is important for lung health. It also acts as the first line of defense against airborne threats like dust, bacteria, and viruses. The sense of smell provided by the nose helps us enjoy food, detect hazards like smoke or gas leaks, and even triggers emotional memories. The shape of the nasal passages also influences the sound of our voice by acting as a resonating chamber. This is why people sound different when they have a blocked nose due to a cold. Overall, the nose is a complex and vital part of the body that works constantly, even though we may not always be aware of its functions. From filtering air to detecting smells, its roles are deeply integrated with other systems of the body. Finally, understanding the anatomy of the nose gives us a deeper appreciation of how this small but powerful organ contributes to our daily lives. It is far more than a facial feature. It is a carefully designed system that manages airflow, detects scents, protects the lungs, and adds resonance to our voice. With its external and internal components working together, the nose ensures that every breath we take supports our health and well-being. Whether you're trying to understand nasal health or simply want to know more about how your body works, knowing the nose's structure and function is a valuable step toward better awareness and self-care. Thank you for watching. If you enjoyed exploring human anatomy with us, don't forget to subscribe to Inside Us for more easy-to-understand videos related to human anatomy and organ system. See you in the next one. Diabetes mellitus is one of the most widely discussed health conditions in the world today, affecting millions of children and adults. Even though it sounds complicated, the idea behind it is simple once you understand how the body uses food for energy. Learning about diabetes is important because it helps us make better choices, recognize early signs, and support people who live with it every day. What is diabetes mellitus? Diabetes mellitus is a long-term health condition where the level of sugar in your blood becomes higher than normal. Your body needs sugar for energy, just like a smartphone needs a battery to work. But that sugar must go inside the cells of your body, where it can be used. To help sugar enter the cells, your body uses a special hormone called insulin, which is made by an organ called the pancreas. Think of insulin like a key and your cells like locked doors. Sugar stays outside the cell until insulin opens the door. In diabetes, something goes wrong with this key system. Sometimes the body makes no insulin, sometimes it makes too little insulin, and sometimes the insulin doesn't work properly. Because of this, sugar gets stuck in the blood and cannot enter the cells. This causes hyperglycemia, which means high blood sugar. When sugar stays high for too long, it can slowly damage your eyes, kidneys, nerves, heart, and many other parts of the body. That's why doctors take diabetes so seriously. It's not just about sugar, it's about protecting the whole body from long-term harm. Types of diabetes. There are different kinds of diabetes, and each has a different reason for happening. Understanding these types helps make sense of how the disease works. Type 1 diabetes. Type 1 diabetes usually happens when the immune system attacks the pancreas by mistake. The immune system is supposed to fight germs, but in this case, it thinks the insulin-making cells of the pancreas are harmful and destroys them. Because of this attack, the pancreas cannot make insulin anymore. People with type 1 diabetes must take insulin every day, usually through an injection or a pump. Without insulin, their bodies cannot use sugar at all, which can be dangerous. Type 1 often appears in children and teenagers, but adults can also get it. The attack on the pancreas does not happen because the child ate too much sugar or did something wrong. It just happens randomly, often because of genetics and unknown triggers. Scientists call it an autoimmune disease, which means the body attacks itself by mistake. Type 2 diabetes. Type 2 diabetes is the most common type in the world. In type 2, the body still makes insulin, but the insulin does not work properly. This problem is called insulin resistance. Imagine trying to use a key that fits the lock but becomes rusty and doesn't open the door properly. That's how insulin resistance works. Over time, because the insulin is not working well, the pancreas tries to make more and more insulin to keep up. But after many years, the pancreas becomes tired and cannot produce enough insulin. This makes sugar levels go higher and higher. Type 2 diabetes is often related to being overweight, not exercising enough, eating too much junk food, or having family members with diabetes. Adults usually get type 2, but more kids and teenagers are getting it now because modern lifestyles involve more screen time and less physical activity. Gestational diabetes. Gestational diabetes happens only in pregnant women. When a woman is pregnant, her body makes special hormones to help the baby grow. Sometimes these hormones make the mother's body resist insulin, causing her sugar level to rise. This usually goes away after the baby is born. However, women who get gestational diabetes have a higher chance of getting type 2 diabetes in the future. Secondary diabetes. This type happens when another condition or medicine damages the pancreas or affects how insulin works. For example, some long-term medications like steroids or diseases that affect the pancreas can lead to diabetes. Unlike type 1 and type 2, secondary diabetes is caused by something external, not by the immune system or insulin resistance alone. Why does diabetes happen? To understand why diabetes happens, you need to know how the body processes sugar. When you eat food, especially foods like bread, rice, fruits, or sweets, your body breaks them down into glucose, which is a type of sugar. This glucose enters the blood and needs to move into the cells. That is where insulin comes in, acting like a helper. In type 1 diabetes, insulin is missing completely because the immune system destroys the cells that make it. Without insulin, the sugar cannot go inside the cells at all. In type 2 diabetes, the insulin is there, but the cells don't respond to it properly. It's like the key is too weak to open the door. This makes the pancreas work harder, but after years of struggling, it cannot keep up. In both types, the result is the same. Too much sugar stays in the blood, leading to health problems. Signs and symptoms. People with diabetes start to notice certain changes in their bodies because the sugar in their blood is too high. They feel very thirsty even after drinking plenty of water because the body tries to flush out extra sugar through urine. They go to the bathroom to pee a lot, especially at night. They feel hungry all the time, even after eating, because the sugar is not reaching the cells, so the body thinks it needs more food. Some people start losing weight without trying, especially in type 1 because the body begins burning fat and muscle for energy. They may feel very tired, have blurry vision, and may take longer to heal cuts or bruises. Some people also get frequent infections because high sugar makes it easier for germs to grow. If diabetes becomes very serious, it can cause dangerous conditions like diabetic ketoacidosis, DKA in type 1, or hyperglycemic hyperosmolar state, HHS in type 2. These conditions must be treated in the hospital. Long-term problems if diabetes is not controlled. If high blood sugar continues for months or years, it can slowly damage many parts of the body. That's why doctors say diabetes needs serious long-term management. High sugar can damage the tiny blood vessels in the eyes, leading to vision problems and even blindness. It can harm the kidneys, which filter waste from the blood. Over time, the kidneys can fail if diabetes is not controlled. It can damage the nerves, leading to numbness, especially in the feet. Because of this numbness, a person may step on something sharp without realizing it, and wounds may not heal properly. This can lead to serious infections. Diabetes also increases the risk of heart attacks and strokes because high sugar affects the blood vessels and makes them weaker or clogged. This is why controlling diabetes is not just about numbers, it is about protecting the entire body. How doctors test for diabetes. Doctors have several ways to check if someone has diabetes. One common test is fasting blood sugar, where the person doesn't eat for 8 hours and then the sugar level is checked. Another test is HbA1c, which shows the average sugar level of the past 3 months. Sometimes doctors perform an OGTT test, where the person drinks a sugary drink and sugar levels are checked after 2 hours. Doctors also check the kidneys, eyes, feet, and blood pressure to make sure diabetes isn't causing damage. How diabetes is treated. The goal of treating diabetes is to keep sugar levels as close to normal as possible. For type 1 diabetes, people must take insulin every day because their body doesn't make it at all. They check their blood sugar often and adjust their insulin based on food and activity. Some use insulin pens, while others use pumps that deliver insulin slowly throughout the day. For type 2 diabetes, the first step is usually changing lifestyle. Doctors often recommend that eating healthier foods, avoiding sugary drinks, and exercising regularly. If lifestyle changes are not enough, the doctor prescribes medicines that help the body use insulin better. Some people with type 2 also need insulin later in life. Doctors also teach people how to check their sugar at home using a glucometer or a continuous glucose monitor, CGM. This helps people understand what foods raise their sugar and how their medicines are working. A simple way to control diabetes daily. Controlling diabetes requires simple but consistent actions every day. Eating healthy meals full of vegetables, whole grains, and proteins helps the body use sugar better. Avoiding junk food, sugary drinks, and too much fast food is important. Staying physically active helps the body use insulin better. Even walking 30 minutes a day can make a huge difference. Keeping a healthy weight reduces insulin resistance. Getting enough sleep and managing stress also improve blood sugar levels. Taking medicines or insulin exactly as the doctor recommends is important. Skipping doses can make sugar levels dangerous. Is there a cure for diabetes? Many people hope for a permanent cure for diabetes, but currently there is no complete cure. Type 1 diabetes cannot be cured because the body stops making insulin permanently. Scientists are working on ways to replace the destroyed cells or protect them from the immune system, but these solutions are still being tested. Type 2 diabetes does not have a permanent cure either, but it can go into remission. Remission means the sugar levels become normal without medicine. This usually happens when a person loses a lot of weight, eats healthy foods, exercises regularly, and keeps the body active. But if they stop these habits, the diabetes often returns. Scientists are exploring new technologies like artificial pancreases, stem cell therapy, and smart insulin. But these solutions take time to develop. Future possibilities and research. In the future, diabetes may become easier to manage because of new technologies. Scientists are studying stem cells that may help the pancreas make insulin again. They are developing artificial pancreas machines that automatically give insulin based on sugar levels. Some companies are working on pills that might replace injections. There is also research on protecting beta cells from the immune system. Although these possibilities are exciting, they are not available for everyone yet. More research, testing, and development are needed to make them safe and effective. So in summary, diabetes mellitus is a condition where blood sugar becomes too high because the body cannot make or properly use insulin. Type 1 happens when the immune system destroys insulin-making cells, and it requires insulin injections. Type 2 happens when insulin doesn't work properly, and it can sometimes be managed with healthy habits and medicines. There is no permanent cure, but type 2 can go into remission with major lifestyle changes. Taking care of diabetes every day protects the eyes, kidneys, nerves, and heart from long-term damage. What is pneumonia? Pneumonia is a serious infection of the lungs in which the tiny air sacs called alveoli become inflamed and fill with fluid, pus, or mucus. Under normal conditions, these air sacs remain open and elastic so they can efficiently exchange gases. Specifically, oxygen enters the blood and carbon dioxide leaves the body. However, when pneumonia develops, these air sacs become swollen and clogged with infected fluid. Because of this, oxygen is unable to pass efficiently into the bloodstream, which results in difficulty breathing, fatigue, weakness, and low oxygen levels in the body. Pneumonia is not a single disease, but rather a general term for various types of lung infection that may be caused by bacteria, viruses, fungi, or aspiration of foreign material. The severity can range from mild illness that improves with rest and medication to a life-threatening condition requiring hospitalization and intensive care. The danger level depends on the cause of infection, the patient's age, immune strength, and underlying health conditions. People who are very young, elderly, or medically vulnerable are at much higher risk of developing complications. This includes infants, children under 5, adults over 65, people with diabetes, asthma, COPD, heart disease, kidney disease, cancer, HIV, or anyone with a weakened immune system. In such individuals, pneumonia may progress rapidly and must be treated promptly and carefully. Symptoms of pneumonia. General symptoms in most adults. The symptoms of pneumonia can vary widely, but most patients experience some combination of cough, fever, breathing difficulty, weakness, and chest discomfort. The cough may be dry or it may produce thick phlegm that can appear yellow, green, brown, or occasionally blood-streaked. The presence of phlegm indicates that the airways are producing mucus in response to infection. Most people develop a fever, which may come with chills, sweating, and shaking. Because the lungs are not oxygenating the body effectively, many patients feel short of breath, particularly when walking, climbing stairs, or lying flat. They may breathe rapidly or shallowly, and some people experience wheezing or noisy breathing. Another hallmark symptom is chest pain, especially sharp pain that becomes worse when coughing, sneezing, or taking deep breaths. This occurs because the lining around the lungs, the pleura, becomes irritated and inflamed. In addition to respiratory symptoms, people commonly feel extreme tiredness, weakness, sleepiness, dizziness, loss of appetite, nausea, or body aches. These symptoms appear because the body is using large amounts of energy to fight the infection. And symptoms in children. In children, pneumonia can look different from adults. Children may breathe very rapidly, make grunting or wheezing sounds, or show flaring of the nostrils while breathing. Babies may refuse to feed, vomit frequently, or appear unusually sleepy, irritable, or weak. Some children may not cough much but may still have high fever and breathing difficulty. Parents should seek medical attention if a child appears to be struggling to breathe or stops responding normally. Symptoms in elderly people. In elderly adults, pneumonia may present in a less obvious and more dangerous way. Instead of fever, they may develop low body temperature, fatigue, confusion, memory changes, or disorientation. These signs indicate that the brain is not receiving enough oxygen. Elderly individuals may also collapse or feel suddenly weak. If the lips, fingertips, or face appear bluish or grayish, this signals dangerously low oxygen levels and requires emergency treatment. How pneumonia happens and what causes it. Bacterial pneumonia. The most common cause of pneumonia in adults is bacterial infection, particularly infection with Streptococcus pneumoniae. This type of pneumonia often develops after a person has already had a cold, flu, or throat infection, because the respiratory system becomes irritated and weakened, making it easier for bacteria to invade the lungs. Bacterial pneumonia tends to develop suddenly, producing high fever, chills, sweating, chest pain, and thick phlegm. Viral pneumonia. Many cases of pneumonia are caused by viruses, including influenza, flu, RSV, and COVID-19. Viral pneumonia is especially common in children and older adults. It may begin like a normal viral infection with fever, sore throat, runny nose, and body aches, but over time progresses into shortness of breath and worsening cough. In some individuals, viral pneumonia can weaken the lungs enough that bacterial infection develops on top of it, known as secondary bacterial pneumonia. Fungal pneumonia. Fungal pneumonia occurs less frequently and typically affects people with weakened immune systems, chronic illnesses, or long-term use of steroids or chemotherapy. It may develop gradually and produce chronic cough, fever, and weight loss. This form of pneumonia requires specialized antifungal treatment. Aspiration pneumonia. Aspiration pneumonia develops when food, liquid, saliva, or vomit accidentally enters the lungs instead of the stomach. This can happen in people who are unconscious, intoxicated, elderly, bedridden, or who have swallowing or neurological problems. The foreign material introduces bacteria into the lungs and causes inflammation. How pneumonia affects the human body. When germs enter the lungs, the body attempts to defend itself by activating the immune system. Large numbers of white blood cells travel to the infected areas to fight the invading organisms. While this immune reaction is necessary, it also triggers inflammation. The air sacs become swollen and filled with fluid, mucus, and cellular debris, which narrows the space available for air to move through. Because of this inflammation, oxygen absorption decreases sharply. As oxygen levels fall, the body becomes weak and organs begin to function less efficiently. The heart must pump harder in an attempt to deliver adequate oxygen to tissues, which may cause rapid pulse, fatigue, dizziness, or fainting. The muscles receive less oxygen, leading to weakness and exhaustion. If pneumonia becomes severe, the infection may enter the bloodstream, leading to sepsis, a life-threatening condition that can cause shock, organ failure, or death. Fluid may accumulate around the lungs, known as pleural effusion, or pockets of pus can form, known as lung abscesses. In extreme cases, the lungs may fail completely, and the person may require mechanical ventilation in an intensive care unit. How pneumonia is diagnosed. Doctors diagnose pneumonia by carefully evaluating symptoms, medical history, and risk factors such as age, smoking status, existing illnesses, or immune problems. During the physical examination, the doctor listens to the lungs with a stethoscope. Pneumonia often produces crackling, rattling, or bubbling sounds or areas where breath sounds are reduced or absent. To confirm the diagnosis, a chest X-ray is usually performed. The X-ray shows areas of the lung that appear cloudy or consolidated, indicating infection. Blood tests may be ordered to check white blood cell levels and inflammatory responses, and oxygen levels may be measured using a pulse oximeter, which clips onto a finger. In some cases, doctors may collect a sputum, phlegm sample, or perform additional scans or tests to determine the exact organism responsible for the infection. How pneumonia is treated or cured. Medication and medical treatment. The treatment of pneumonia depends entirely on its cause. Bacterial pneumonia is treated with antibiotics, and it is extremely important to complete the entire prescribed course, even if symptoms begin improving early, in order to fully eliminate the infection and prevent resistance. Viral pneumonia does not respond to antibiotics, so doctors prescribe rest, fluids, fever reducers, breathing support, and sometimes antiviral medicines. Fungal pneumonia requires antifungal medication, usually over a longer treatment period. Supportive and home care. Supportive care plays a crucial role in recovery. Patients are advised to drink plenty of water to thin mucus, rest adequately, eat nourishing foods, and avoid smoking and exposure to pollution or dust. Breathing exercises and sleeping in an upright or semi-reclining position may help reduce discomfort and improve airflow. Cough medicines are sometimes prescribed, but many doctors recommend allowing the cough to clear mucus naturally unless it becomes severe. Hospital treatment. Patients who have severe pneumonia, dangerously low oxygen levels, weak immune systems, or multiple health conditions may be admitted to the hospital. In the hospital, treatment may include intravenous antibiotics, oxygen therapy, intravenous fluids and breathing support, and in very severe cases, intensive care monitoring or ventilator support. Recovery time depends on the severity of infection and overall health. Some patients recover noticeably within 1 to 2 weeks, while others may need several weeks or even months before lung function fully returns to normal. Fatigue may continue for some time even after the infection is gone. How pneumonia can be prevented. Prevention plays a major role in reducing pneumonia risk. Vaccination is one of the most important protective measures. The pneumococcal vaccine protects against a major bacterial cause of pneumonia and is recommended for young children, older adults, and people with chronic illnesses. The influenza vaccine and COVID-19 vaccine help prevent viral infections that commonly lead to pneumonia. Practicing good hygiene is equally important. Washing hands regularly, avoiding touching the face with unwashed hands, covering the mouth when coughing or sneezing, and avoiding close contact with sick individuals reduce exposure to infection. Quitting smoking is extremely important because smoking damages the natural cleansing system of the lungs and significantly increases pneumonia risk. Maintaining a healthy lifestyle, including balanced nutrition, adequate hydration, regular exercise, and sufficient sleep, helps strengthen the immune system, making the body more capable of fighting infections. People at risk of aspiration should eat slowly, sit upright while eating, avoid lying down immediately afterward, and seek treatment for swallowing or reflux problems. When to seek urgent medical help. Immediate medical care is required if a person develops severe shortness of breath, chest pain, confusion, bluish lips or fingertips, persistent high fever, fainting, or worsening symptoms despite treatment. These warning signs indicate serious oxygen deprivation or complications that may become life-threatening without urgent care. Thank you for watching. See you in the next video.
An average adult human brain is about the size of a medium cauliflower, measuring roughly 15 centimeters or 6 inches in length. It typically weighs approximately 1.3 to 1.4 kilograms. It is surrounded and protected by cerebrospinal fluid which cushions the brain and helps to remove waste. Here is a brief overview of all parts of the brain. We will discuss every part in more detail later in the video. Cerebrum. Responsible for higher cognitive functions, cerebellum, coordinates motor movements, balance, and posture. Brainstem. Controls heart rate, breathing, digestion, and sleeping. Thalamus. Acts as a relay center, directing sensory and motor signals to the appropriate parts of the cerebral cortex. Hypothalamus. Regulates hunger, thirst, body temperature, and the release of hormones. Limbic system. Contains structures like the amygdala and hippocampus and is responsible for emotions, memories, and certain aspects of behavior. Pituitary gland. Releases hormones that regulate several physiological processes, including growth and metabolism. Basal ganglia. Is a group of nuclei that play key roles in movement regulation, habit formation, and certain aspects of cognition and emotion. Corpus callosum. Facilitates communication between the left and right sides of the brain. Ventricles. Produce and circulate cerebrospinal fluid to cushion the brain and remove waste. Now we will discuss all these parts in a bit more detail to understand what are these and how they work. Cerebrum. The cerebrum is the largest part of the human brain, accounting for approximately 85% of its weight. It is responsible for most higher-order cognitive functions and can be described in further detail as follows. 1. Hemispheres. The cerebrum is divided into two symmetrical halves, known as the left and right hemispheres. These two halves are separated by a deep groove called the longitudinal fissure but are connected by a thick band of nerve fibers known as the corpus callosum. Left hemisphere is typically associated with logical thinking, analytical processing, and language. In most right-handed individuals, the left hemisphere is dominant for language. Right hemisphere is more involved with creativity, spatial ability, artistic, and musical skills. It also plays a role in interpreting visual information and processing emotions. Lobes of the cerebrum. The cerebral cortex, the outer layer of the cerebrum, is divided into four main lobes. Frontal lobe. Parietal lobe. Temporal lobe. Occipital lobe. Frontal lobe, located at the front of the brain, it's responsible for executive functions such as reasoning, decision-making, planning, and problem-solving. It also oversees voluntary movement, speech production, and aspects of personality and behavior. Parietal lobe. Positioned behind the frontal lobe and above the temporal lobe, it processes sensory information from the body such as touch, taste, and spatial positioning. The somatosensory cortex, which maps tactile information from the body, is located in this lobe. Temporal lobe. Found on the sides of the brain, near the ears, it's associated with processing auditory information, understanding language and the formation of long-term memories. It also has roles in recognizing faces and processing emotional responses. Occipital lobe. Located at the back of the brain, it's primarily responsible for vision. This includes processing visual information from the eyes, interpreting colors, and recognizing shapes and movement. Gyri and sulci. The surface of the cerebrum is highly convoluted, consisting of ridges, gyri, and grooves, sulci. These convolutions increase the surface area of the cerebrum, allowing more neurons to fit in and enhancing cognitive abilities. Cerebral cortex. This is the outermost layer of the cerebrum and is composed of gray matter. It is densely packed with nerve cells and is responsible for higher cognitive functions, including thinking, perceiving, producing and understanding language. The thickness and structure of the cerebral cortex can vary across individuals and has been associated with various cognitive abilities and personality traits. White matter. Located beneath the cerebral cortex, white matter is made up of myelinated or insulated axons, which are nerve fibers that connect different parts of the brain to each other. The myelin gives this region its white appearance and helps accelerate the transmission of signals between neurons. Basal ganglia. Though often considered separately, the basal ganglia are a group of nuclei deep within the cerebrum. They play a crucial role in movement regulation, habit formation, and certain aspects of cognition and emotion. Limbic system. Also nested within the cerebrum, this system comprises the amygdala, hippocampus, and other structures vital for emotion, behavior, and long-term memory. The cerebrum, with its intricate structures and networks, is central to human consciousness, enabling us to think, learn, create, and experience emotions. It remains a focal point in neuroscience research as we strive to unravel the mysteries of human cognition and behavior. Cerebellum. The cerebellum, often referred to as the little brain due to its appearance and size relative to the cerebrum, is an essential structure located underneath the occipital lobes of the cerebrum at the back of the brain. Here's a detailed breakdown of cerebellum. Structure and functions. The cerebellum is divided into two hemispheres, similar to the cerebrum, and has a finely convoluted surface, which helps maximize its surface area. These convolutions are made up of folds known as folia. In the middle, a narrow worm-like structure called the vermis connects the two hemispheres. The cerebellum plays a key role in fine-tuning motor activities. While the cerebrum might initiate a movement, the cerebellum makes adjustments to ensure the movement is smooth and precise. It helps maintain balance and proper posture, particularly when the body is in motion. The cerebellum is essential for tasks that require practice and repetition, such as riding a bicycle or playing a musical instrument. More recent research has revealed the cerebellum's involvement in certain cognitive and emotional functions. This includes processes like attention, language, and regulating fear and pleasure responses. Layers. The cerebellar cortex, which is the outer layer of the cerebellum, is made up of three distinct layers. Molecular layer. The outermost layer containing few neurons but many extensions from other cells. Purkinje layer. Contains Purkinje cells, large neurons that send inhibitory projections to the deep cerebellar nuclei. Granular layer. The innermost layer made up of tiny granule cells that send excitatory projections up to the molecular layer. Deep cerebellar nuclei. Embedded within the cerebellum are clusters of gray matter known as the deep cerebellar nuclei. These serve as the primary output cantors of the cerebellum, communicating its processed information to other brain regions. Peduncles. The cerebellum communicates with other parts of the brain via three paired structures known as peduncles. Superior cerebellar peduncle. Connects the cerebellum to the midbrain and thalamus, primarily carrying output from the cerebellum to other brain regions. Middle cerebellar peduncle. Connects the cerebellum to the pons and is the primary input route to the cerebellum. Inferior cerebellar peduncle. Connects the cerebellum to the medulla oblongata, facilitating both input and output between the cerebellum and other brain regions. Despite cerebellum's smaller size compared to the cerebrum, the cerebellum contains more neurons and plays a crucial role in a variety of tasks, ensuring they are executed with precision and grace. Brainstem. The brainstem is located at the base of the brain. It serves as the bridge connecting the cerebrum and cerebellum to the spinal cord. The brainstem is critical for basic life functions, such as breathing, heart rate, and blood pressure. It's involved in reflexes, including those that regulate balance and hearing. It plays a role in regulating the sleep-wake cycle. The brainstem serves as a conduit, with ascending tracts transmitting sensory information to the brain and descending tracts sending motor information to the body. Cranial nerves 3 through 12 originate from the brainstem, controlling functions such as facial expressions, swallowing, and sensation in the face. Here's a detailed look at brainstem. Components. The brainstem can be divided into three main structures, each with specific features and functions. Midbrain or mesencephalon. The most superior portion of the brainstem, the midbrain, is located beneath the thalamus and above the pons. Prominent structures include the cerebral peduncles, which contain motor and sensory tracts, and the corpora quadrigemina, composed of the superior and inferior colliculi. The superior colliculi are involved in visual reflexes, while the inferior colliculi are associated with auditory processing. The midbrain houses the red nucleus, involved in motor coordination, and the substantia nigra, which plays a role in reward and movement. The midbrain contains nuclei for cranial nerves 3 and 4. Pons. Positioned between the medulla and the midbrain, the pons appears as a bulging region on the anterior part of the brainstem. It primarily acts as a relay station, transmitting information between the cerebrum, cerebellum, and spinal cord. The pons also plays a role in regulating the sleep-wake cycle and houses nuclei for cranial nerves 5 through 8. Medulla oblongata. Located closest to the spinal cord, the medulla oblongata is the most inferior part of the brainstem. It regulates several vital and involuntary functions, such as heartbeat, blood pressure, and respiration. Any significant damage to this region can be life-threatening. It also contains the pyramids, which are two elongated ridges on its anterior surface where motor fibers cross over or decussate. This decussation is why each hemisphere of the brain controls the opposite side of the body. The medulla also houses nuclei for cranial nerves 8 through 12. Reticular formation. Spanning the length of the brainstem, the reticular formation is a network of interconnected neurons. It's vital for consciousness, sleep regulation, and overall alertness. Damage to this area can result in coma. The reticular formation also filters sensory input to decide what information is relayed to the cerebral cortex. Thalamus. The thalamus is located in the center of the brain, just above the brainstem, and is nestled between the cerebral cortex and the midbrain. Each hemisphere of the brain contains a thalamus. It is composed of two symmetrical egg-shaped masses of gray matter, and these are surrounded by a thin layer of white matter called the external medullary lamina. It performs various functions. Relay station. One of the primary roles of the thalamus is to relay sensory information from peripheral receptors and the spinal cord to the appropriate regions of the cerebral cortex. It processes and transmits inputs from all the senses, except smell, to associated cortical areas. Motor functions. The thalamus also receives information from the cerebellum and basal ganglia and relays it to the motor areas of the cerebral cortex, aiding in the coordination and modulation of movement. Sleep and wakefulness. It's involved in regulating states of sleep and wakefulness. The thalamus plays a role in controlling the sleep spindle activity during the sleep cycle. Consciousness. The thalamus contributes to consciousness and alertness, particularly through its connections with the cerebral cortex and the reticular formation in the brainstem. Pain perception. The thalamus is also involved in processing pain signals and can modulate the perception of pain. Hypothalamus. The hypothalamus is a small but crucial region of the brain that plays an integral role in connecting the nervous system to the endocrine system via the pituitary gland. The hypothalamus is located below the thalamus, approximately above the pituitary gland, and forms the lower walls and floor of the third ventricle in the brain. It's about the size of an almond and consists of various nuclei and nerve fibers. The hypothalamus is connected to many parts of the central nervous system, including the cerebral cortex, thalamus, basal ganglia, and limbic system. The pituitary gland is attached to the hypothalamus by the infundibulum, or pituitary stalk. Through this connection, the hypothalamus can regulate a wide variety of bodily functions by influencing hormone release from the pituitary. Hypothalamus perform various functions, for example, endocrine system regulation, autonomic nervous system regulation, temperature regulation, hunger and thirst regulation, sleep-wake cycles and circadian rhythms, emotion and behavior, and memory. Limbic system. The limbic system is a collection of structures in the brain involved in various functions including emotion, behavior, motivation, long-term memory, and olfaction. Limbic system is a group of interconnected structures. Here are some of the primary components. Amygdala. A small, almond-shaped set of neurons located deep within the brain's medial temporal lobe. It's key in processing emotions, especially those related to fear and pleasure. Hippocampus. Located in the medial temporal lobe, the hippocampus plays a critical role in forming new memories and connecting emotions and senses, such as smell and sound, to memories. Thalamus. While primarily a relay station for sensory and motor signals to the cerebral cortex, the thalamus does have connections with the limbic system and is involved in some of its functions, especially in relaying sensory information. Hypothalamus. Situated beneath the thalamus, the hypothalamus regulates vital functions like hunger, thirst, body temperature, and sleep. It also helps in controlling mood and emotions and is integrally linked to the endocrine system. Cingulate gyrus. An arc-shaped region that plays a role in regulating aggressive behavior and linking behavioral outcomes to motivation. Parahippocampal gyrus. Surrounding the hippocampus, this region plays a role in memory encoding and retrieval. Basal ganglia. While often associated with movement, the basal ganglia have connections to the limbic system and play a role in certain emotional and cognitive functions. Olfactory bulbs. These are involved in the sense of smell, which can evoke strong emotional responses and memories. Pituitary gland. The pituitary gland, often termed the master gland, is a small, pea-sized structure that plays a crucial role in the human endocrine system. The pituitary gland is situated at the base of the brain, right below the hypothalamus, and is housed within a bony structure called the sella turcica of the sphenoid bone. It is attached to the hypothalamus by a thin stalk known as the infundibulum or pituitary stalk. The gland is divided into two primary sections, the anterior pituitary, or adenohypophysis, and the posterior pituitary, or neurohypophysis. Anterior pituitary, adenohypophysis. This lobe synthesizes and releases several hormones, regulated by releasing and inhibiting hormones sent from the hypothalamus via a portal blood system. Hormones produced and released by the anterior pituitary include growth hormone, thyroid-stimulating hormone, adrenocorticotropic hormone, follicle-stimulating hormone, luteinizing hormone, prolactin, endorphins and enkephalins. Posterior pituitary, neurohypophysis. Unlike the anterior pituitary, which produces hormones, the posterior pituitary stores and releases hormones produced by the hypothalamus. Hormones released by the posterior pituitary include oxytocin and vasopressin. Basal ganglia. The basal ganglia are a group of nuclei located deep within the cerebral hemispheres that play crucial roles in a range of functions, including the control of voluntary motor movements, procedural learning, habit formation, and emotion, among others. The basal ganglia are composed of several interconnected nuclei, which includes striatum, globus pallidus, subthalamic nucleus, and substantia nigra. The basal ganglia have several pathways that process and relay information. Direct pathway, indirect pathway, hyperdirect pathway. Proper balance between these pathways is crucial for smooth motor control. Function. Basal ganglia perform several functions, which include motor control. The basal ganglia, in coordination with the cerebral cortex, thalamus, and brainstem, help smooth out and coordinate movements. They're involved in the initiation and termination of movements, ensuring movements are fluid and purposeful. Procedural learning. They play a role in the learning of routines or sequences, especially motor sequences. Emotions and behavior. The basal ganglia are connected to the limbic system and have been implicated in the control of emotional behaviors and responses. Cognitive functions. They contribute to certain aspects of cognitive processing, decision-making, and task switching. Corpus callosum. The corpus callosum is the largest bundle of nerve fibers in the brain that connects the left and right hemispheres, allowing them to communicate and coordinate with one another. Anatomy and structure. The corpus callosum lies beneath the cerebral cortex, arching around the lateral ventricles. It is composed of over 200 million axonal projections, facilitating the transfer of information, integration of motor, sensory, and cognitive performances between the cerebral hemispheres. The corpus callosum can be segmented into different regions based on its anterior to posterior orientation. Rostrum, genu, body or trunk, and splenium. Functions. Corpus callosum performs several functions, which include interhemispheric communication. Its primary role is to integrate motor, sensory, and cognitive information between the two hemispheres. For instance, sensory information received in one hemisphere can be shared with the opposite hemisphere to produce coordinated motor outputs. Facilitate learning. It's believed to play a role in the sharing of learning and memory processes between hemispheres. Redundancy and recovery. In cases of cerebral damage, like a stroke, to one hemisphere, the corpus callosum may facilitate compensation by transferring functions to undamaged areas in the opposite hemisphere. Ventricles. The ventricles of the brain are a connected system of cavities filled with cerebrospinal fluid, CSF. These cavities not only serve as a reservoir for CSF but also play a role in its circulation and in cushioning the brain. Anatomy and structure. The ventricular system comprises 4 main ventricles. Lateral ventricles, first and second ventricles. These are the largest of the ventricles and are found within each hemisphere of the cerebral cortex, having a curved, horseshoe-like shape. Each lateral ventricle consists of a central body and 3 protruding horns, the anterior or frontal, posterior or occipital, and inferior or temporal horns. Third ventricle. This is a narrow, funnel-shaped cavity located in the midline, between the left and right thalamus. It's connected to each lateral ventricle by the interventricular foramen or foramen of Monro. Fourth ventricle. Located between the pons and the cerebellum. It communicates with the third ventricle above through the cerebral aqueduct or aqueduct of Sylvius. Function. Cerebrospinal fluid or CSF production. The ventricles are lined by ependymal cells, and within the ventricles, specialized structures called choroid plexuses produce CSF. Brain protection. CSF acts as a cushion, providing a protective layer for the brain against trauma. The fluid also helps maintain intracranial pressure, which is crucial for normal brain function. Nutrient and waste transport. CSF facilitates the exchange of nutrients and waste products between the brain and the blood. This was the basic overview of human brain, its components, and functions which brain and its components perform. We will go in more detail in some other video. That's it for today. Hope you liked this video. For more videos on human body and organ system, please subscribe to this channel. See you in the next video.
The human eye is a sophisticated optical instrument that functions similarly to a camera. It collects light from the environment and transforms it into neural signals that the brain interprets as vision. Every component of the eye, from its external protective structures to its intricate internal layers, works in harmony to focus light accurately onto the retina, where visual information is processed. External structures of the eye. The external aspects of the eye are designed